So, sorry. Thank you very much for those presentations from the WHO, and it really highlights the opportunities we have for working together in, our major areas of both reducing trauma and, importantly, the disability associated with trauma, which then is a non-communicable disease in a way, and other ways of being involved in working to reduce the impact of non-communicable diseases. And I think we've seen some openings given to us of how to get in there and continue with our collaboration, which we have been doing since we launched the decade at a meeting in 2000 at the WHO with the then Director General. So I'm not going to speak very long because we've had 2 very intense days and we've covered a lot of things, and things are going to continue beyond this meeting, following through the things we've been discussing in today's workshops. But I've been extremely encouraged in how we've continued to really concentrate on the benefits of working together and getting rid of egos and seeing the greater things we can achieve by the ongoing collaboration we've established. It's been more challenging than perhaps we expected at the beginning of the decade to get everyone seeing the benefits of working together and the win-win, but I think we are a long way forward, and we've heard some good examples from different countries of how it has been successful by that collaboration, cooperation, with a key goal now of raising priority, on the understanding that once we get priority raised, a lot can happen. It's a bit like we were just hearing, once you get a declaration at the UN or the World Health Assembly, then things can move forward. So the key thing, as we've said in our strategic planning, is getting that level of priority, and then lots of things start happening. So we've got to get there, and we've highlighted in the workshops earlier today that we feel some of the key things, and it came out from the presentation of WHO, is identifying the burden more accurately and showing the inequities that exist. And as you know, we're involved in the Global Burden of Disease revision, and we're trying to get the whole impact of musculoskeletal conditions much better recognized. I think we need to also try and encourage more thinking about the YLDs rather than the DALYs, because the DALYs are always distorted by mortality, and the YLD is a much better reflection of the burden on society of those people living in imperfect health and who are therefore a cost to society, not only for their own suffering. So I think we've got to get the data about burden and monitoring musculoskeletal health and having strategies. And we've got a lot of projects we've done over the years, and there's ongoing projects in different continents to achieve that, to know why they're important and what we want to be done about them. And then it's actually to get it happen. I think we had a good discussion in terms of trying to guide us into the future of who does what. We are an affiliation, a network. There's no intention that the decade does everything, and it was quite clear from some of those charts that it's accepted that a lot of things have to be done at the national level, the National Action Network level, the organizations and societies, with the decade playing a strategic role, a coordinating role, a disseminating role, and impacting it into policy. And that's the higher level that we perhaps can add to all the affiliated organizations, and somehow get that common message driven forward. And we were talking earlier about how we can do that and show it's not only a win-win for health, but it's a win-win for all sorts of sectors of society when we're talking about conditions which affect 1 in 4 adults. So for employers, all sorts of people marketing things, 1 in 4 of their customers, 1 in 4 of their employees are going to have a problem where we can perhaps contribute to a solution. In terms of moving forwards, and we gave people the opportunity of, one wish, and probably it's, from what I've heard, putting the 2 together, either Bill Gates breaks a leg playing football or gets a sore knee. Okay? But somehow or other, we need to get that high profile. And it's a curious thing that despite all the connections of orthopedics with important people having joint replacements and various people having these problems, is not something that people want to speak up for and speak up about. Over the years, we've always looked for this. We've looked at sports people, and we've never really found people who are really prepared to speak up. And personally, I think we might need to make more of a focus on maintaining musculoskeletal health rather than disease and getting people who are more keen to say why staying physically fit and healthy is important to them. And in that way, highlight the negative side of having problems. So I think we need to get that and get funding. The plan, as you've seen, is very much focusing around core funding for sustaining the organization and the collaborations, and then project-based funding about the things that we prioritize as what we think are going to achieve things. So you've seen this framework, and just to reiterate, the main vision is to keep people moving, reducing the burden and cost of these conditions, maintaining our values and credibility so that we can work in good collaboration with organizations like the WHO. We've had some interesting suggestions of other organizations we can collaborate with and target to try and influence, keeping our focus around our constituents who have some specific interests, but realizing that really it's working together that we can move this forward, and suggestions of programs. And I think we've had good guidance for the ICC with ICC in interaction with yourselves as individuals and NANs to try and really develop a program of activities over the next few years. We had some good suggestions also coming from the round tables. We haven't collated them all, but hopefully there we have some activities that people agree to do, which are quite simple and quick hitting. In terms of the actions from the earlier workshops, I think the key things we can do very easily is to report this meeting and disseminate it widely so people are aware of the sort of discussions we've had. And most importantly, it was highlighted that we need to re-emphasize that the decade is continuing and we still have a lot to do. And also consolidate our support. The NANs, the supporting organizations, get them aware exactly how they can help and how we can make them as strong as possible. I think we've got a very good set of NANs. I mean, people here have done amazing work in developing all these networks, and from the prizes we saw given, it's amazing what is being done in some of the countries. And we need to try and help everyone get to that same level. And then, as I said, develop the program of activities to work on. And I think one way of developing the NANs and the organizations is by getting them engaged in various activities. I think that's always a good way of bringing people together to give a focus. So in terms of the structure, as you've heard, the coordinating council giving governance and direction, and the idea is to develop programs with various activities within them, all aiming eventually to raise priority and improve outcomes for the people, supported by the Secretariat and the National Action Networks and supporting organizations and regional councils, because we do believe a lot of things, there's commonality at the regional level where you can't always come up with the same message for the whole world. So we have to have an ability to make things more regionally relevant and so people can support each other. Just again to highlight the structure of the Coordinating Council with the Secretariat working at the international level and working on strategy and policy and communication, as I said, but very important support of the NANs, which are a unique structure, powerhouse that we have as an organization, but also with the support of individuals and the regional and international organizations. Now I'd like to introduce and welcome the International Coordinating Council, who will be working on this. It's going to be supported by the office, which is moving to where I am, in Truro, and Madeline Homewood, and Katie Edwards and Jim Howarth will be helping support the decade, and they've been helping at the meeting, and I'm sure you've all met them here. So we're based down in Cornwall, in the southwest of England, and we very much look forward to coordinating things. And as you've understood, really in this day and age with modern technology, it doesn't really matter where the base is because we can very easily globally support people. And I think we're very lucky to have that abilities at this time, okay? So the key thing is that we have to continue into the next decade and meet our aims.